So hi everyone. So today I'm going to take a presentation about SPD, that is sensory processing disorder. Okay. So in what happens in SPD is like you know how all the sensory processing works. So I'll just give you an overview. It's basically the ability to take information through the senses and which is organized and interpreted in the brain, and then we respond to it. Okay. So how? There'll be, these are all our senses. Okay. How many senses are there? Smart. Okay, so this senses, they all have sensory receptors. Okay, so these receptors, they act to the stimuli. Now there are three kinds of stimuli. Okay, one is mechanical, chemical and electromagnetic. Mechanical is two things, touch and okay. So there'll be so touch will be there. In chemical will be smelling and the taste, and this will be electromagnetic is the vision. All right. So accordingly, all these stimuli, they work together and they travel through the nerve cell. Okay, they travel through the nerve cell and they are changed into electrical signals. Those go to the brain, and in the brain all the different kinds of, see, when you see a thing or when you sense a thing, okay, it's not just one senses that is involved. If you, for a food example, the food, taste, smell, your eyes, like there are a lot of things, no? So all of this is imagined together, processed together and then reacted. Okay, then as it comes in two ways. Either there will be a response, that means if something is hot, so you move your hand because you can understand, and second time, because you know it's hot, it will store the information for the next time. So that is the reason next time when something is hot, you automatically know that if you touch it, it's going to burn your hand or it's going to affect you. Okay, so that's how it works. So in SPD, what happens is this sensory receptor is affected. The mechanism is still idiopathic. Nobody knows exactly the reason, but we suspect that this is how it works. These sensory receptors don't have the energy to reciprocate what sense they are collecting. Okay, so in this now what happens is okay. So in SPD, what eventually I told you, right, how it affects. Now how it is caused, there is no specific reason for how it's caused. We take it like it's a genetic disorder, can be genetic disorder. And another thing, the biggest thing, it is not a disease. It has a lot of, it has its own complication, it has its own types of problems, but still it is not considered as a disease. It is only considered as a disorder, as a symptom for other things. Okay, so this is specifically seen in those people who have autism or any spectral diseases. Okay, spectral, there is a spectrum, no, autistic spectrum. They come for almost everyone will have SPD, but those who have SPD will not have autistic or any other. Okay, so it's a symptom, but it also can be a disorder. But according to our WHO and other people who characterize, it is not considered as a disease. Okay, then coming to the types. Okay, so SPD has three types. Sensory modulation disorder, that is over responsivity to a thing. Okay, so that means some of them, they have a habit of hitting. Okay, so when they hit, they can't stop hitting. They'll be hitting, they don't know how to stop. If they drink water, okay, they don't know when to stop, so they'll be keeping drinking water, like they'll keep on drinking water. Okay, under responsivity. So if you hit them, if they get hurt, they won't react. It'll be okay, you can see the blood all coming, but they won't react. That is because they don't know how to respond to it. Craving and seeking is, they will show specific responsivity to certain kinds of activities, like coloring. Some of them will enjoy coloring, so they will only do coloring. Okay, and the moment they don't get it, they get very hyper, but rest of the time they'll be very depressed, and they won't like to initiate in any other activities. Okay, then coming to sensory discrimination disorder. In this is it basically all the senses. Okay, so visual, auditory, tactile, taste, smell. So for different people, different SPD patients, they have different kinds of reaction to it. Okay, so for some of them, they will have specific taste problem. Okay, so they cannot taste certain food. So if it's too spicy, their eyes will be watering. Okay, but they can't recognize it. Okay, so those kind of visual, they will have color problems. Okay, like we go for eye checkup, they will show us 2 colors. No, for them they have specific, so they have certain liking to certain things, so they will only do those particulars. So if they see a pink color, they want it. Okay, they see some specific food, they want it, or they will start getting very agitated, they'll start fighting for it, and they start cussing for it. Okay, stuff like that. Then last is sensory based motor disorder. Now postural disorder is basically the balance and core stability. Okay, so they won't be able to walk, they'll just fall off. They won't be able to stand. You know, we process in our mind, when we get up from a chair, we know that our legs have to be strong. So they do not have that. Okay, so for them, the moment they get up, they'll fall, because they don't have core stability. And dyspraxia is basically the motor planning. So when we walk, we know we need to go left, so we turn left or we turn right. Even though they are turning, they plan, you know, I want to turn left or right, for them to turn their leg will take a lot of time. Okay, they won't be able to process it, or sometimes maybe they will go to the opposite side, or they will just stand there because they are so confused what to do. All right. Then coming to the symptoms. Okay, so the common behavior in these people you will be seeing is hitting, pushing, yelling, fighting with other friends. Okay, and sleeping problems, because some of them, when they are over responsive, they will be having ADHD and other things like that, so the focus is less, but they will be too much anxious, hyperactivity. Those people, you always have to give them daily, their routine has to be set from morning to night. You cannot leave them. The moment you leave them, they get hyper because they don't know what to do, and eventually they won't sleep in the night because they'll be very hyper. Their food, everything has to be maintained. Then unable to sit and talk, picky eaters, frequent tantrums. With autism, okay, those who have SPD and autism or any other spectral disease like with ADHD or something like that, they will have, you know, head banging, scratching. You know, if they see blood, they don't realize it is paining for them, but they can't stop, so they will keep scratching it more. So if they see their teachers, if they bite, so they see marks, right, on the teeth, so they'll keep trying to bite it more because it looks different for them, something new for them. They don't know it's wrong. Even though they know it's wrong, they can't stop it. Okay, and the basic symptoms, okay, these are what is characteristics shown, okay, significant, but symptoms will be, you know, overly sensitive to touch. Okay, they can be hyper and they can be hyposensitive. Okay, so inability to habituate to certain sounds. So certain sounds, they'll close their ears, they'll bang their head because they cannot take the sound. Okay, avoid taste and smells, and, you know, poor self concept, emotional and social problems. So some of them will be very depressed because they are not able to express what they feel, right? Because they know they don't want to do certain things, but they can't stop, so they are so scared to act out. But many of them are blessed with SPD also. Okay, how? Because when they are this characteristic of being over responsive, some of them like studying, so there will be a lot of genius students who will be autistic and who will have SPD. So they will be very bright, but in their specific subject. But those same people won't be able to tie their shoes or, you know, do certain things, can't hear their voice. So they are sent to a special school, right, for their particular problem. Okay, then yes, coming to the treatment. Okay, no, I'll go to the diagnosis first. Diagnosis is, there are many diagnoses actually, almost, one second, yeah, many of them are there. Sensory integration and praxis test, evaluation of iris, sensory integration in development, but usually many of them are there. But what we use here is this one, okay, sensory integration and praxis test. Okay, it is actually a test of almost, there are 17 tests. Okay, in this is like a one test which has 17 subtypes. Okay, subtypes, all of them, they take 10 minutes for each test. Okay, so it's like space visualization, figure ground perception, standing and walking balance. So space visualization is basically, you know, you remember we used to learn this cuboid, okay, when we were in school, right? We all learned this, no? So we know when you look at a cube from top, it will look square, from side it will look square, but if you give it a 3D view, it will look like a cube, right? So that's how we learn, no? So they give certain things to them and they try to analyze what it is. Okay, then design and copying. So they will keep something and they'll try to ask them to copy what it is. Okay, then graphesthesia, that means for this is for sensitivity, okay, all towards the skin. So they will draw something here and they'll ask you to recognize what they've drawn, and they will actually be able to see it, but they want to feel it. Certain times they close the eyes. So that is what for each and every test they do it, and every test is 10 minutes. That means that much time they are giving for each. So praxis will be there. So for oral praxis, movement of the mouth, okay, postural movement, bilateral coordination, all these are checked, okay, and together there will be a score, and according to that score they are tested for SPD. Okay, then coming to the treatment, this is sensory integration therapy. There is no medication for this disorder, okay, but what we consider is sensory integration therapy. In this, what they do is, these people have problem with their senses, right? So for touch, suppose, so you guys have seen that squishy balls, they will have that you know, like they're like that pine things, no? So what happens is they give them that to hold, so that basically gives them the idea of how to feel things, because certain of them, some of them will have problem with touching, no? So they want to keep on touching, they want to feel how it feels, okay, for them that is how they understand, okay. So at certain time they'll hold you hard and they don't realize it's hard and they'll keep holding you very tightly. So that's how they treat. So there are many kinds of basically sensory integration therapy is a fun kind of treatment that they give, okay. So they will make you play games in that, they will give you certain things to, you know, understand how sense works, okay, certain smell, certain food. Then sensory diet is given. Sensory diet is actually specific food, hot food, cold food, okay, fruits, you know, certain watermelon, it will get a squish in your mouth, right, because it's very light, right, but certain there will be hard kind of thing like coconut, then you have to literally bite it. So they give different kinds of food, that is sensory diet, and they have to make sure that they don't give one diet, they give multiple diets also, so that at one time they can understand the difference, okay. Other than that, what they can lifestyle modification is basically, you know, same I said, give them continuously non-stop routines. They'll just have routines morning from till night, from the time they get up till the time they sleep, it'll be just packed. They don't give them breaks, okay, no breaks for them, it's just activities after activities after activities, okay. Then in school, especially, I'm sorry I didn't mention there, for specifically for school, in the school it has to be like every hour the child has to go for a 10 minutes walk. Why? Because if you give too much activities also, they get confused. So walking actually relaxes your brain at the time. For almost all the disorders related to your neurological disorders, they tell you to go for walk because it relaxes your body. Second thing, like, you know, swinging, kids, no, they realize, enjoy it, so it's like cooling for them. And you know, access to headphones in the class. So in their classes, certain students will be given headphones. Why? Not too much music, and they can concentrate. It helps them specifically for those kids who have ADHD also, okay. Then access to fidget toys, that means holding, in which they can touch. So because these students while studying also they want something to hold or touch, so they'll be given those kind of things, okay. And last, you know, they'll be asked to give a chair, specific chair for them, which they can, you know, move their leg, or because they want to, they'll be very hyper, so they want to move, so they'll be given a proper chair for themselves. So these are the things that they give in the school, okay. And coming to listening therapy is very important for them, because they need to understand, right, for if any of these therapies have to work, they need to understand what the child is specifically going through, because everyone is having different issues, no. So in listening therapy, so certain kids are scared of like certain things, you know, like somebody will take my shoes and run away. So okay, so then you scare them. Okay, so like if you don't do this, I will take a shoe and run away. If they are scared of heights, so I will, like, you can scare them saying, if you don't do this, we'll keep you there. Okay, so these are different kinds of therapies that can be helped by understanding what their problems they have. Okay, and then comes the occupational therapy, that is same, reinforcement therapy, listening therapy, speech therapies, all those therapies that they require. Okay, coming to complications, it basically affects their lifestyle. They'll be very depressed and all those things. And as PharmD students, what we can also help them is, because I said this is not a disease, they don't have any clinical insurance for this specific disease, okay, there won't be any insurance. So for this treatment, SPD is actually very costly. All this occupational treatment and all is actually very costly. So basically sometimes, but for autistic or all other diseases, they have insurances, okay. So you can, even the parents their parents also will eventually suffer from a lot of depression and other things also, because their child is like that, no. So this is the basic thing. Complications, as I said, they will have problems. SPD is not properly treatable. It's not like 100% treatable, but there have been very, many people who has come out of it, but it can be reduced by these therapies. So thank you. That was about this. Any question?